Hello, my name is Lisa Decker, and I'm a postural alignment therapist with Egoscue Institute. And today we're going to go over an exercise called Airbench. This is a great exercise I use quite frequently. It's a great one to neutralize the pelvis, to remove rotation in the pelvis, but really nice exercise if you're experiencing lower back pain or sacroiliac joint pain. In many cases, this can help. Sometimes it can be contraindicated if you have a lot of knee pain. So please be careful and know your unique alignment. Every exercise we use for postural therapy can be used to restore function depending on your unique alignment, or it can be used as a functional test to see where you may have dysfunction in the body. Okay, so tune in and body sense to find out if this exercise is right for you. So this exercise I use a lot to release the muscles of the lower back, okay, to get the actual primary and secondary hip flexors to function bilaterally and symmetrically, okay. It can also be used to remove rotation, like I had said, specifically in the lumbar spine, and to restore function, okay. So let's give this one a try, and you'll need some wall space for this exercise. So come on up and stand near a wall and take a look down at your feet. Now we want to ask, are our feet straight and level? Because they need to be straight and level for this exercise. And very often we feel like our feet are straight and we look down and we recognize they're not. So really take a look down. You want your feet, as a rule for this exercise, to be about 1 to 2 fist distance apart. Okay, so very often I'll see people with their feet too wide. So 1 to 2 fist distance apart, straight and level. Now, if that's uncomfortable for you, okay, you can actually lift up your leg. This is called your femur bone, and externally rotate it or internally rotate it. Okay, depending on whether you have internal or external femurs. That's depending on where your knee is positioned. Most of us will have external femurs, or many of us will have external femurs, in which case you would take the leg, lift it, heel off the ground, internally rotate it, and set it back down. Okay. See if that feels a little bit like there's a little less torque. Okay. From there, you're going to come back to the wall. You're going to walk your feet forward, and you want to make sure your feet are walked forward enough that you're not going to be feeling this in your knees. So you want a 90-degree angle, if not a tiny bit more than a 90-degree angle in this exercise. Okay. From there, you're going to inch your way down the wall. Weight remains in your heels, and you're going to press your lower back into the wall. And from here, we can use this exercise as a functional test. All right, so you want to ask yourself, can you fit a hand between your lower back and the wall? You should not be able to. Is that the same or different on each side? Okay. Can you see your toes? You should be able to see your toes here. If your knees start to bother you, you have two choices. Walk your feet out more, okay, or come up the wall a little bit, all right? Either of those two choices is okay as you get your body able to do this exercise, okay, more functionally. Again, the weight being in the heels is going to take the pressure off of the knees, all right? And you want to stay symmetrical at the lower back. This is going to help to reduce rotation, help to engage both the primary and the secondary hip flexor muscles. All right, help to stabilize the pelvis. And it's going to help to elongate and relax the lower back muscles. Okay, so Airbench is a really wonderful exercise for so many things, but know your body. Use it as a test to find out if this exercise is right for you. Okay, you can find out more on my website, alignedfit.com. Thanks.